Hello, Sophie the Hobbit here, and this is the test-taking strategies video that I've been promising. So first off, I want to say when you come to a question, you're going to want to know if it's an expected outcome or if it's unexpected. So let's say your patient's laying there and everything seems normal and the results are normal, and you're like, well, what are you wanting me to do? Are you trying to trick me? Question? Yes, it is trying to trick you. So if it's expected, you're either going to continue to monitor or you're going to document the findings depending on what answer choices you have. So say you come to a room where the question says your patient is, I don't know, breathing really fast or something. Is that expected? Well, obviously it's not, so something's wrong. So you got to figure out, these are really good. Okay, it's really good how to figure it out what to do. Either A, you're going to make an intervention, or you're going to do an intervention that makes the difference in this situation. You know, like say they're restless or something. You know, you're probably thinking, hypoxia. What am I going to do? Only choose an answer that has to do with fixing the hypoxia, or you're going to call the doctor and to get ready to intubate and stuff. So pretty much, if it's unexpected, you're going to do an intervention that makes a difference, or you're going to call the doctor. And those were pretty much the only two choices you'll ever have. But you should make a note card, just like I drew it, just like that, expected or unexpected, and then follow it along. And every question you come to, ask yourself that stuff. And believe me, it will help you a lot. Another one is stable or unstable. So if you know your patient is unstable, this is life or death stuff, you better pick the killer answer. Meaning, if you do not do whatever it is this answer choice is, the patient will die. And that's a really important judgment thing that they're looking for. So let me get to some basics strategies. You always need to focus on the question. Don't read too much into the problem itself. Just look at the question. What are you asking me? What do you want to know? That's what you need to be answering. Sometimes, because they love to give you extra stuff that doesn't matter. You need to focus on that question. The next thing is you need to know your ABCs and how to follow them, which is changing, I think, in a couple months. One of our review people was saying that it's going to be like C something, CAB. I don't know. Hopefully your school will know more about that, but the tests are changing, and we'll see how it goes because it hasn't happened yet. So you also need to know Maslow's, and I actually made note cards on each Maslow's hierarchy of needs to know what it was, because they're not gonna test you on stuff they're gonna test you on stuff they want you to figure out. So if you know Maslow's by heart, you should be able to be like, okay, you know what, this is not important. Pain, that's not as important as breathing. Let's get you breathing, and then we'll worry about pain. Okay? So another thing you need to do is assess before taking action. This is 2 rules to it. Okay? So say something is wrong with your patient, but you don't know. You're looking at the cardiac monitor at the nurse's station, and it's showing that your patient's dying. Don't call code blue. Go into the patient's room, and then assess them. Okay? Now, if they are flatlining, of course, call the code blue. But if not, you probably want to assess them first. So look for the assessment answer in choices where you're not really sure what's going on. Now, there is an exception to this rule. Always, when in distress, do not assess. When in distress, do not assess. If your patient is not breathing, don't be like, let me take your temperature, or let me do your vital. No, you need to get them breathing again. So, when in distress, do not assess. Okay, do that. That would be where you go into the unexpected nursing intervention that matters, or call the doctor kind of stuff. Try to have all the information before calling the doctor. That's another strategy. I never really had this come up. During practice questions, I always had, like, okay, well, I don't know the vital signs, I'm going to call the doctor. But it's hard to distinguish between, are they in distress? You don't assess. So that I always had trouble with. So you should really practice assessment questions. That happens to be kind of one of my weaknesses, knowing when it's, crucial to get the vitals, or when, I need to, go ahead and just call the doctor and not worry about that stuff. So this is something they're going to teach you in nursing school, and you won't see it practiced in clinicals, but you should follow it, and the test wants you to follow this, and that is the least invasive first. Always do the least invasive action first. And that also includes giving the least amount of medication first. So say your patient's in pain and you need to give them morphine. Are you going to give them the higher dose of morphine or the lower dose? you're always going to give them the lower dose because it's always the least invasive first. Then you're going to reassess. If they're still in pain, you go back and give them more. Okay? Also, never trust hearsay. You need to go assess. So say your PCA comes in and they say, so-and-so's bandage is coming off and they're bleeding everywhere. Go assess it, because everywhere to them may be a couple drops versus, everywhere it's spilling on the floor and they're going to die. You need to go and assess. So don't ever trust hearsay. Don't be like, oh, I need to call the doctor. Go assess your patient, then call the doctor. Okay? Always empower your patients. This is kind of a psych thing, but it's really helpful. I found it very helpful because they love to throw in empower questions. And that means you want them to do their own stuff. Don't wash their face for them. Just give them the rag. Let them wash it themselves, unless they have no hands. You know what I'm saying? Now, the exception to this rule is if they're depressed, you're going to want to do stuff for them, because if they don't have the energy to, like, wash their face or something, you can, help them do that, and that'll lift up their mood versus, giving them the washcloth and getting mad at them for not doing it themselves. So my last piece of kind of strategy is delegation. Never give someone an unstable patient unless they are a trained RN in that, floor or whatever. So if you got like an RN from like L&D and you're on the emergency department, you wouldn't give them an emergency patient. You would give them a stable patient, like a DVT or something. Something every nurse would know how to take care of. Don't give them something like, I don't know, like say if you're on a ortho floor, don't give them something with like a hip fracture that is seriously infected and in danger. You give them something basic and someone who's doing well. It's always stable patient to new people. And like for LVNs, you would do the same thing, but you have to remember, you need to know the difference between an LVN and an RN. They can do certain things and they can't. And then PCAs as well. Being a tech and being on the floor, you get a good idea of what the PCAs do versus what the nurses do. It really helps because your hospital's obviously going to follow what the license tells you to. So my final thing of advice is when you come upon a question, reword it in your head. Okay, repeat that. That's going to be the new question, and then read all your choices and try to figure out which one's really answering the question. And then, if you need to, this is something always told me to do, but I have a hard time doing it. But it is choose the last man standing. So if you don't know the answer, but some of the answers look stupid, just cross those out, and then the last one standing, even though you don't know what it is, sometimes that's the choice. That's the answer. Okay. Sometimes it's not about sometimes it's about just eliminating what you know is false. And then my last piece of advice is if there's two answers and they look the same and you've got to narrow down to those two, sometimes both of them are wrong. If they're exactly the same thing, usually that's the wrong choice. You need to go back and reread and see if you missed something, because odds are you did, and usually you'll catch it. If you're like, these answers are the same, I can't decide, reread it. It might be the one that you're like that you ruled out first. It happens to me all the time, and I'm like, oh, I forgot to read this part of the question. So the best thing you can do is practice. Make note cards, read those note cards, practice using all these strategies that I just read to you. This is throughout every review I've ever done. It's really helpful. This is what got me through nursing school. And I wish they had taught this in the beginning of nursing school, because then I wouldn't have, done so poorly on some exams. But good luck, and my disclaimer is this is just an entertainment video. Don't take anything seriously. If you need help, go seek it elsewhere. Good luck on your tests, and I hope these strategies helped. I would watch this video before you take your test just to reiterate all these important strategies. I'm sure you've heard them before. Just, get them in there. Use them. Good luck!